Professor Nasidi, I am throwing this to you. Again, I don't know, how current the statistics you gave us, 49% of existing healthcare and 41% of access. I'm sure that's not the outcome that the Ministry of Health, represented by Dr. Camille, is expecting from the, robust input that he said they are putting into the system. What do you say about, the free cesarean section? You think it's sustainable, or is there any other way that can be achieved?
Please, can you come again? What do I think about cesarean section? I didn't hear you very well.
Yes, the free cesarean section, because he said the Federal Ministry of Health has, directed tertiary institutions across the country to take in any woman who has need, for a cesarean section, a C-section, and cannot afford it, to take her and, provide the services for her pro bono at that point. So I'm saying, do you think this is sustainable?
Well, as I said, the key is, what do we do to get Nigeria to improve on its health indices so that we are not among the 4 worst nations with poor health statistics as regards maternal mortality, infant mortality, and so on and so forth. So actions that will improve our situation are those, quality access to quality healthcare at the primary healthcare level. So cesarean section and emergency response, is the issue of, those who have gunshots, injuries, accidents are taken to hospitals, and they say, oh, if you don't bring police report, you are not treated. I'm happy Nigeria has ruled that this initiative by the Ministry of Health to get all hospitals to respond to any woman that is in need or their need of a cesarean section to act before payment, that is life-saving. But it won't have a major impact on the general, statistics of, maternal mortality and that we are facing. But then secondly, the emphasis, especially if we are going by this, World Health Day theme, is to emphasize on how to make the dream of Professor Olukoya Ransom Kuti, who established the primary healthcare, come true. How can we get more than at least 70–80% of Nigerians to access, good healthcare system? How can we get them to our children, 80% of our children to be fully immunized? And how can we get, our population to have, other facilities that are outside health sector, like good quality water, good access to information that health education that can increase the awareness of the population on how to, help themselves, and so on and so forth. I think these are the things that, I believe can make major impact. And I'm happy, at the last information provided by the Director of Statistics, Planning and Statistics, shows that the ministry and this government is now going to emphasize in activating, this primary health care, at least 70% of them to be able to provide these essential services that are life-saving, that can reduce our poor statistics in health indices for us to come out of the wood. So yes, it's good to do the cesarean and the tertiary discipline, but how many tertiaries and how many of them can the have access to? What about the private sectors that can provide, these services? Should they also, provide, save the woman and then send their bill? Or is it just the tertiary health institutions that are owned by government? That needs to be clarified.